trust-wide. It's a campaign I'm involved with alongside Helen Stewart, who's the lead nurse for quality and clinical standards. She's actually involved in ward accreditation today, so she's not here, apologies. And Brenda Webb, who's a programme manager from the PMO, who's not at work today, so I'm afraid it's just my dulcet tones. This project really came out. So June 2018, Brian Dolan came to the Trust for a week and there was a big launch of #EndPJ-paralysis, headed up by the PMO at that time, and there was a real motivation and drive and positivity. 12 months after Brian left, a few of us went and re-audited actually what was going on the wards, and across the board, all the changes just weren't being sustained. There were 2 exceptions to that, and that was Beaconsfield East and Lister, who were very much internally driving their changes and have very much taken ownership and had plans to keep things rolling out. But actually on all the other 18 wards, the change just wasn't being sustained. So we wanted to come up with a new approach to facilitate and empower staff at a ward-based level across the MDT to change practice. April this year, NIHR brought out an article which was a huge meta-analysis of all the research out there saying this does make a difference, this does make a change. In terms of making a difference, the evidence supported that it prevents deconditioning. If we don't let our patients decondition, then we don't always have to rehab them afterwards. So actually there's an impact on length of stay data, and it's just that black and white. By maintaining normal activity and function for patients, it's promoting their mood, their dignity, their individual sense of identity, prevents a loss of confidence, and also actually there's been quite a lot of research into the falls data, and if you keep people moving when they're in hospital, they don't then fall when you get them up or fall when they go home. And also all the normal body processes, so by getting up, by moving, you're supporting your skin integrity, you're reducing your pressure ulcers, your normal digestive processes. The knock-on effects are hard. Actually getting tangible evidence for those on a local level is going to be one of our challenges that we will come on to. So what does good look like? For us, good looks like Jean sitting up out of bed to have her meal. If you're lying on your bed, flat on your back, you're trying to eat your rice, chances are it's going to go everywhere. It's going to get in your bed sheets, it's going to go on your bedclothes. Then when it comes to going to sleep, you're not in that frame of mind. It's just not ideal. So what have we done so far? Our steps have been really simple, really basic. We've been doing a very slow ward by ward rollout. We very intentionally haven't done a rebrand and a relaunch because we had to look at what happened 18 months ago now and actually try and do something differently. So we've worked with the ward managers and just picked wards that were interested and engaged and just tried to empower the MDT with that. So our first stage with all the wards was looking at the day rooms. Do they have space for the patients to go if they're appropriate to medically? So we've got basic dining tables for some of the day rooms, which the swap shop's been brilliant for, just making sure that the day rooms have got appropriate chairs and actually protecting the day room space. So all the meetings that are happening in the day rooms and all the family chats and all the MDMs, actually where else could they happen? Let's keep our day rooms for our patients to use. Just thinking about what's in the day room, so we've just been getting some newspapers, some books, some activities. We had an overhaul of all the dementia boxes and the activity boxes and just looked at what resources were in there, what was missing, and just tried to put the resources back on the wards. We've used some of the volunteers that are working with the Trust as well, just to look at actually providing that engagement. Quite a few of the wards now are starting to do some group work just to engage patients, so rather than just sitting flat on their back, lying looking at the ceilings, actually let's get up and let's do something, let's make it meaningful, let's make it purposeful. All our elective surgery patients now are getting information at the pre-op stage, so there's a letter going out as part of the pre-op pack about expectations. When you come into hospital, please bring in footwear, bring in clothes, and actually you're going to be expected to get up and do and maintain what's normal for you. We have discovered, and the data will show that in a minute, but actually for what's making it work this time is having a really strong, regular, visible presence on the ward. So we're being at board rounds, we're starting conversations. Actually, who's going to get out of bed this morning? We've been talking to some of the consultants and actually identifying a patient in every bay. Could you have your medical review of that patient? But actually them sitting out of bed so they can be part of that conversation. They can be more engaged rather than the doctor is here to see me, actually making that much more two-way and empowering our patients a lot more. We've been on the wards at visiting time, just talking to relatives and just saying, do you know what, when you come in next, could you bring in, could you think about this? You know, and even for the bed-bound patients who've kind of very low function, actually just having a familiar blanket over them from home, what that can do to mood and to spirit is huge. We've been running training sessions formally, informally. We will talk to anyone that will listen to us. And just trying to keep the visuals there. So things like the wards that we rolled this out on, there's a sheet at the end of every bay just for the nurses to fill out, or whoever's in charge of that bay, you know, how many patients can get out of bed today, how many actually have, and what do we need to do to get those numbers different. The data so far, so our light green line is Jersey, our blue line is Hayes, our red line is Drayton, and our purple line is Paget. The top graph is just looking at the total number of patients that are dressed. By dressed, that may be fully, that may be partially, it depends. You know, if somebody's got drains in, then actually just having a cardigan on is a positive step for them. So we're not worrying too much about the detail. And the bottom is looking at patients that have mobilised or been out of bed. So for some patients, that just might be hoisting out of bed for a meal. For other patients, that's going to be up, that's going to be walking themselves to the bathroom, going with some help, going to the donor, etc. So, apologies, those are all American dates, I didn't change my little axis. So this was from July this year up until last week, and I think it's pretty fair to say we've just got upward trends, it's happening. It's very, we've got this big jump here and jump here, and that was about, we had 10 days where between the three of us we were on the wards every day for 10 days, so we were just keeping conversation, keeping it at the forefront. Otherwise, support's been maybe once or twice a week. So kind of we could see that when we had the resources to have a big boost, the data followed. Our big key successes have been about capturing a few of the Band 2 staff, some of the healthcare assistants, and really getting them to take a bit of ownership and a bit of pride in the project. So up on Jersey at the moment, one of the healthcare assistants, Christian, said to Marion, can I just put a board up at the front, just so people coming onto the ward know what we're talking about? And bless him, in his break on shift one day, he created this bit of magic. Down on Paget, the team down there have created a really big visual, and actually just having that constant reminder just keeps, hopefully, the agenda at the front of people's minds. And that was, again, healthcare assistants based down on Paget who took the lead on that. Jersey have also now created a little booklet all about this that again was initiated by the healthcare assistants up on Jersey. Our big learning from this has been about the importance of trying to get ownership from people that are on the wards. Rather than this being something that is coming in from outside, it's got to be about changing the practice and the thoughts of the people at ground level. So what can we do to empower those people? We learned very early on that having the same plan for all the wards was never going to work. It's got to be individualised and bespoke for the areas and to what's going to meet their clinical needs. The importance of kind of just being visible and keeping this going was probably, we'd underestimated at the beginning, just in terms of time commitment, and just about keeping this at the front of people's agenda. Lister, who were a ward that had actually managed to maintain the momentum since last June, we had a little look at what they've been doing, how they've been doing it, and how they've been sharing that out across the NDT, just to see what we can learn and if that's applicable to other wards or not. How are we sharing our learning? We are just talking to anyone that will listen, and that is anyone at every level. So we're doing training for nurses, training on the wards, talking to relatives, talking to patients, just having a chance to just keep promoting and shouting out the message. We are going to continue the rollout, and just by going pretty much a ward a month seems to be more effective than going in with too much, talking to the ward managers and then actually just getting in there with the Band 2s, the Band 3s and working up from there. We are in the process of arranging a sustainable clothing bank, because you say to people PJ paralysis and the first thing that comes from everyone is patients don't have their own clothes, they can't do their own laundry. So we've been talking to Synergy, talking to the charity, and just trying to get a pool of sustainable, rewashable clothes for the patients that don't have their own. So at the moment we've got things for people to travel home with, but we haven't got, someone's an inpatient for a month, what can they be using throughout that patient journey? So we're well on the way with that. We've been liaising with nursing education about just getting in on the HCA induction so that all the new joiners coming into the trust, we can start getting our messages out and promoting. and just doing a little bit of training at that initial capture moment. But what matters to me, boards at every patient's bedside at the moment. The therapy team are being particularly positive and strong about keeping those updated, but actually getting the whole MDT to say, do you know what, this patient can get out of bed with this isn't the one. It's lunchtime in half an hour. Let's work together as an MDT. Let's use the information that's there and visible to work for the patient's best interests. Comms are being particularly helpful and supportive at the moment. They've just created some posters for us. I've actually got copies because I was imagining being in the boardroom and passing things around. Which they've only come to light this week, so they're going to start to appear all over the wards, and we've had to get some copyright things, which they've been... I'm very happy. I was going to say they can go round. There's a whole bunch of bits and bobs. So there was the Lego campaign that Addenbrooke's had initially started up, that they're happy for us to... they've given us the okay to put our logos all over, and then we've got some local publicity with some of our staff in and that sort of thing, just to keep the visible presence up. Comms have initially potentially agreed to support with us suggesting some tweets to go out, and that will be aiming at the public as well as aimed at staff and patients. So, you know, is your relative coming into hospital today? Have you remembered to pack? Bum, 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 that sort of thing, just to keep the mind shift and the positive work going on, keeping momentum. So the posters we've just developed, the other thing we're in the process of developing is some liners to go on the trays for patients in their meals, so that actually when they've sat there and had their meal and they're looking at their empty tray or their tray, that actually they're just some very basic information. Have you got someone coming to see you today? Could they bring in your clothes? Have you asked a nurse if you could get out of bed to have your meal? That sort of thing, just to get the patient mindset shifted a little bit. So we've got a few prototypes that we're just trialling with patients to get some feedback on before we start printing. Our other big challenge at the moment is going to be about how we collate tangible evidence. So the support we've had from the PMO is a little bit challenged at the moment because they're struggling to prove that this is a cost-saving measure for the hospital. We know it's best practice, but actually collecting our local data is challenging. So we're just having some conversations and thoughts about that. We're collecting some patient stories about positive experience, because to me this is really about quality improvement as well. And then some work just to try and keep the self-sufficiency, because long term the three of us can't just keep being visibly present all the time. So that's where we're up to. Are there any